Hello and welcome to this overview of Chapter 8 from the Isham textbook. Okay, so we're in cleaning and decontamination on page 130. Ready, set, go. You should know what is clean. Cleaning is defined as the removal of all visible and non-visible soils and other foreign material from medical devices being reprocessed. So we may need to make sure that we're removing the gross soil. That should be done at point of use, actually. And then all visible and non-visible soils. Okay, big topic here. Look at the pictures on page 130. The dried soil inside of a bulb syringe. These things were, they're pretty much done away with. You can't clean something like that. But it is a good illustration of some difficulties, some challenges faced during cleaning. There are other things that are very hard to clean, like this arthroscopic shaver. The images you see were taken by using a borescope. A borescope is a very thin, little flexible scope that can go inside of devices and look and inspect during the cleaning process to see if the cleaning is being done right. And then after the cleaning process to see if the cleaning has been done right. And on the next page, 131, there is another system that uses a fluorescence-based protein detection. I want to draw your attention to the picture on the bottom where it shows biopsy forceps prior to reprocessing. So this is before cleaning, and what you see is there's lots of gross soil on it. Using the fluorescence-based protein detection. After cleaning, the picture to the far right where it shows there's still some residual soil, but the picture in the middle, to the naked eye, this item looks like it's been cleaned properly. So you have to use your tools, you have to use your brain, you have to use your detergents, your enzymatics, and everything properly, and follow the instructions for use when cleaning. Flip the page to 132. Now, introduction to the decontamination area. I'm going to hit some highlights here. You should know that there are safeguards in process for the cleaning of soiled items. We need to make sure that we're protecting the employees and the patients and everybody else who may come in contact with these items. In many cases, the decontamination area is located near the provider of the largest amount of soiled items, which is the operating room. Okay, conditions. You should know what the conditions are in the sterile processing department's decontamination area. You should know what the temperatures are, what the relative humidity is, and what the air exchanges are. Let me explain air exchanges. It's negative pressure in the decontamination room. So contaminated air is vented out the ceiling. Well, I just turned red. Let me see if I can change that. Vented out the ceiling. Contaminated air is sucked out of the top of the room. So by doing this, it's ensuring that if the door opens or the pass-through window opens, it's not going to allow that contaminated air to go into the any other area. We do consider that air to be contaminated because of the nature of the activities in the room. Okay, 10 negative changes per hour. Know what the temperature range is and what the relative humidity is properly in decontamination. And know that only people who have legitimate business in the decontamination room should be in there. This is true of our department. Let's say it's just slightly more true in the decontamination room. You may see people wanting to use your decontamination room or any part of your department as a shortcut or come in there just to chit chat. So this should not be allowed. The decontamination room is a hazardous place to work, and so you may need an emergency shower and eye wash station within so many feet or seconds of where the contamination could happen. It's not really just about contamination, it's also about the fact that there are chemicals being used in the decontamination room, which could harm you if you get it in your eyes or on your skin. So because decontamination room is a very dirty place, logically it follows that we should make extra efforts to try to keep it a clean place. Doing things like making sure that horizontal work surfaces get cleaned and disinfected routinely. Pay attention to these bullet points on page 133. Okay, I'm not going to read them all to you. Read the bullet points on page 133. And the definition of hazardous waste, or I should say biohazardous waste, excuse me, that's what it says here. This blood, little pieces of tissue, things like that. Anything that came out of the human body is considered to be a biohazardous and waste. So the dress code in the decontamination room is it's your regular dress code for any other place in the department. And then you add your personal protective equipment. So if you're on the clean side or in the storage area, you're wearing your hospital provided scrubs, you're wearing your hair covering, and in decontamination, you add to that your PPE, your personal protective equipment. So this is going to protect you from splashes and just, you know, the things that you're removing from the instruments. Hand washing and frequent use of appropriate hand germicide agents is required. So when you, well, yeah, before you put on your PPE, go ahead and wash your hands, put on your gloves, your PPE, you know, your gown, your hair covering, which you already had on, but now it magically becomes PPE when you're in the decontamination room. And when you take all of these off, wash up good. And then maybe go to the locker room and take off those dirty scrubs. Take a shower if you want to and go home in your street clothes. You should never wear your hospital provided scrubs to your home or out in public, especially if you've been in a decontamination room, because you picked up microorganisms. Even though you're wearing your PPE, you've still picked up microorganisms. And personal protective equipment is described on page 134. Okay, the 3-sink arrangement used for manual cleaning. So manual cleaning means things that are being cleaned by hand. And many of these are then going into a mechanical cleaning process. And some of them are just going to be put through the pass-through window. So the 3-sink arrangement is only possible if you have 3 sinks. I understand there are some decontamination departments that have don't have the appropriate type of sink. They may have 1 or 2 sink basins. So I can't do anything to change that, but understand what this 3-sink arrangement is about. You clean, you rinse, and then you rinse in purified water. Purified water, like distilled or deionized or reverse osmosis. Changing colors again. What is going on? All right. So reverse osmosis, pyrogen, distilled water, and deionized water are all defined here on page 135, and I guess I'm just going to stay red. Okay, so know these things. Know them. Now we're on cleaning tools on page 136. Believe it or not, water is a very important cleaning tool. I know, you usually think of tools as screwdrivers and, well, wrenches and things like that. Your tools for cleaning include water and brushes and chemicals. Okay, when speaking of water, the best water to have would be pure water at a pH of 7. So since we're on Earth and in Arizona, we don't really have pure water coming out of the tap. Many facilities, though, will have purified water coming out of a tap at the sinks. Not all of them. You really should have purified water coming out of the tap, because you really should be using purified water as the final rinse on everything that you clean. Water pH and hardness needs to be kept in check. Soft water would be better than hard water for cleaning. Soft water is not appropriate for rinsing, because soft water actually does have some salt in it, basically, which will leave marks or spots on the instruments. Understand pH as it pertains to the cleaning process. Neutral is the most preferred. And cleaning brushes. Now, the cleaning brushes that you see on page 137 in that picture under the pH level comparison, you have lumen brushes, and then you have, they're just handle brushes. We call them toothbrush style brushes. Toothbrush style brushes come in nylon bristle or soft brass bristle or some other soft metal bristle. If you're using a metal brush on something, it needs to have been approved by the manufacturer of the something as to whether or not you can use a metal brush on it. Not everything can have a metal brush put on it. It can do some serious damage to finishes on instruments or different materials. So we usually relegate metal brushes to routine stainless steel instruments that have some seriously difficult materials to remove from them, which if we are in a place where we're really doing the topic of chapter 7 correctly, those will probably be very greatly reduced, the amount of, let's say, blood dried onto the serrations of a clamp. You should use the correct brush size. So I'm going to use the broom analogy. Are you ready? The broom analogy goes like this. When you are brushing, when you're sweeping the floor, do you hold the broom so it's just slightly over the top of the floor, maybe occasionally touching the floor? No, because that wouldn't remove the dirt you're trying to remove. Do you hold the broom, you press it down so hard that really all it does is sort of smear the dirt around? No. So proper size lumen brush means you're going to be using a brush that is neither too large and going to smear the things around, or too small and just going to occasionally hit the inside of the lumen. Proper size lumen brush can be determined by looking at the IFU, or there are different charts, or you could literally stick the brush into the lumen and see if it seems to be doing some brushing activity and is long enough to go through the entire length of the lumen. These brushes that we're talking about, they're usually, they're not necessarily single use, but they're disposable, not single use. So you can use one until its usefulness has gone away, until it's used up. Like the picture where it says discard brushes when they're worn. One of them looks like an old toothbrush that you've been using to scrub the toilet with for about 1.5 years. Yeah, that should have been thrown away a long time ago. Cleaning cloths are also used. So cleaning cloths should be used once and then put into the hamper so that you limit cross-contamination. They should always be lint-free. Lint-free is always better. Low lint is acceptable provided that you're going to rinse any lint off of the objects. Let's just go with lint-free. Sponges. Sponges really should be single use. We're talking of these sponges that it shows on page 138 at the top. These are used for flexible endoscopes. And in order to eliminate the potential for cross-contamination from one scope to another, because that is a big deal, they should be single use. They usually come impregnated, already filled up with some detergent that you can use on the scope and then throw it away. So if you are using them repeatedly, I will tell you, do not think that you can clean this and it's not going to happen. You should replace them at least daily. All right. There's other tools we have like instrument air. Know what that is. There are irrigation hoses that you can use to flush lumens, or perhaps a spray nozzle for cleaning wheels on mobile equipment and carts. You may have a cart washer, which would be really nice, where you can put these carts in it. If you don't, here's something to consider. If you roll in a cart into a dirty room and you clean the entire cart very well with disinfectant wipes, and then you roll that same cart out into the clean area without cleaning the wheels, you've just taken contamination from the decontamination room into the other area. So wheels do need to be cleaned. There are mechanical cleaners, as mentioned earlier. The ultrasonic and the mechanical washer disinfector are the two we're really going to talk about. So just because you have a mechanical cleaner doesn't mean you don't have to do the manual portion of the cleaning. So mechanical cleaning does not replace the need for manual cleaning. You can clean something manually and then put it in the mechanical cleaners. So let's say you have an instrument set. I'm just going to use a small instrument set. Maybe it's got 10 instruments in it. Maybe they used half of those, 5 instruments. You can tell they used them. They made a separation. They told you this is what we used and this is what we didn't use. Awesome. So you can definitely focus on what you know was used, but then pay really close attention to things that have hidden areas like lumens. Just always assume that those were used. It's going to be best in the long run if you assume they were used and clean them as if they were used. Now, what I'm going to tell you is that there are not enough hours in the day to hand clean each and every item in every set throughout the entire day. Most of these sets, the vast majority of these sets that are sent up, not even half the instruments end up touching the patient. And so if there's 100 instruments in a set and you clean 100 instruments by brushing each and everything, every surface, every time, that's taking you a lot of time. If they only use even like 20 instruments out of the set, like I said, there's not enough hours in the day. So, but the ultrasonic, which cleans by cavitation and vibrates at 20,000 to 30,000 vibrations per second, ultrasonic, that's above your capacity to hear. You'll hear the ultrasonic generator, but you won't hear the ultrasonic. Never mind. Okay, so we have things like this. So let's say you take that 100 instrument tray and you focus your attention on the 20 items that were used, look through the set, look for any suctions or anything that have hidden areas, make sure that you hand clean those, and then you can put them in the ultrasonic, which is going to do a lot toward cleaning things. It's going to remove even more than you did with your brush, and it's going to help to get into the recesses, like areas, you see here, where these two pieces of this instrument come together. There's an area in there where you cannot brush. I don't like turning red. Oh well. Maybe I'll use a Snapchat filter. Okay. So an ultrasonic is a mechanical cleaner that can only be used if you've already manually cleaned the items. And then the ultrasonic, if you're on page 140, you see that the ultrasonic has an IFU. Bath temperatures, it says, for cleaning instruments in an ultrasonic should be between 80 and 109. This is pretty much true for manually washing in a sink as well. So you should definitely note that if you use the hotter temperatures of 140 or above, that's going to cause the proteins that are left on the instruments to actually coagulate and become very, very difficult to remove. When you're using an ultrasonic, you should always make sure that you do what's called a degassing. So the first cycle that after the fill should be run empty. This allows the excess bubbles that may be formed during the filling process to escape. Look at the bullet points on page 140. Okay, they continue on to page 141. It's very basic stuff in some ways. Make sure the instruments are opened, make sure that you don't overload it. Every ultrasonic has its own instructions for use, for load limitations. There's a picture of what is obvious to me that it's overloaded ultrasonic. I can even see that some of those instruments are sticking out of the surface of the water. I don't know how that's supposed to work. But I mean, when you put your clothes in the washing machine, do you leave one pant leg sticking out? Of course not. Okay, ultrasonic is a very good tool. Certain things cannot go into an ultrasonic, like chrome-plated or ebonized instruments, things that are made of plastic, cork, wood, chrome, or rubber. Fiber optics will become destroyed. If you like destroyed fiber optics, then you put them in an ultrasonic, but it's going to be a very expensive mistake. Washer disinfector. Now, let me tell you, there's something also called a washer sterilizer, which I've never seen in my life. The point is, I'm not sure what the point of having a washer sterilizer is. A washer sterilizer will not make something actually safe to use on the patient. It's just an extra level of microbial destruction before sterilization. Okay. But the washer disinfector is what you're going to be seeing in probably your hospital. Okay. So it says here in the note, automated mechanical washers are not appropriate for washing electrical, battery, or pneumatic devices unless otherwise stated in the device's IFU. And I've seen IFUs that do allow you to use a washer disinfector to clean them. But it's not everything. Washers work on the principle of impingement, and you know what this is. So let me explain it to you so you know what I'm talking about. You ever put your thumb over the end of a garden hose and the water comes out faster? That's impingement. Very basic. You restrict the water and it's still going to force its way out, and when it does, it comes out fast. So washers work on impingement. And you need to make sure that the spray arms are kept clean. I'm on page 143, and I'm going to address the garbage on the bottom of the washer. This is the kind of thing that can get up into the spray arms and block the holes in the spray arms and cause them not to function properly. All right, back to page 142. Oh boy, this is a big chapter, guys. On page 142, it says many things. So look at the bullet points. Washers have, most washers, I've not seen all washers, but every washer I've ever used has multiple cycle options, and these are needed. If you're just going to run regular instruments that need to be lubricated, then you would probably use an instruments cycle that's as it's programmed into the washer. If you're going to run regular needing lubrication instruments that are very light and delicate, like a microsurgery set, then you would probably choose a gentle instrument cycle. If you're going to run implants, which should never have lubrication put on them, then you would use a cycle called ortho, or some other cycle that is programmed so that it doesn't add lubrication. Cycle that you would choose instruments or gentle for this adds lubrication. Okay, so there are multiple cycle options available. And, okay, there's a good picture around here somewhere. We'll just keep going. Some of this is a repeat from the instrument resource manual, like about not overloading the washer, the racks. You need to make sure that the spray arms can move freely. So if you have your instrument standing up, let's say you have some 9-inch long needle holders and they're standing up, the spray arm wants to turn. Okay. Not only can you damage the instruments, but it's going to stop the spray arm from turning, which defeats the purpose of having a spray arm that's capable of turning. It's not going to be able to contact all the surfaces. And instruments should be disassembled, and then their small parts can be placed inside approved containers, like the ones shown in the picture. So some things have to be disassembled through cleaning. Other things you wish you could disassemble them, but you have to look for ways to disassemble them. So when in doubt, ask somebody who knows, somebody who's been there before you. Hinged instruments should be open to permit direct contact of the water and the detergent. Trays that have multiple levels should be opened, and each tray should be placed separately on the washer's rack. Failure to separate multi-level trays can cause the wash process to fail because the cleaning solution can't reach the areas of the instruments. Trays that have lids should be opened up. Those holes that are drilled into lids of many trays are not there for the cleaning process to take place, but they are there for the air to escape during sterilization and the steam to get in. Okay, that washer screen at the bottom of the washer, as it shows in that one picture, just remove the trash. Whenever you see it, you see one thing in there, pull it out. And be very careful about what you're putting into the washer. Okay, sometimes washers get scale buildup, and you may run what is called a decontamination cycle on many washers. It'll just call it decontamination, but it's for decontaminating the washer itself, and you will use something like a descaler, which you would use according to the IFU. Very good. Okay, one of the many cycle options that are available on these washers would be like a utensil cycle. If it's bowls and cups and little medicine cups and bowls in many sizes, graduated pitchers, they don't need lubrication, and they should not have the high impingement. So it would be a utensil cycle, which is basically a gentle cycle with no lubrication. Cart washers are a thing. They're a glorious thing. They can really take a lot of the work and make it super easy. Some cart washers have a built-in instruments capability. They do not all, so you would never wash instruments in a cart washer unless there was a special cycle and that cycle was selected. Automated endoscope reprocessors. This is another machine. This is, so we usually say reprocess, talking about the entire process, cleaning, sterilization, etc. So, but what an automated endoscope reprocessor can do is it can disinfect, or sterilize. But then when you take the item out of the automated endoscope reprocessor, it's no longer going to be sterile because there's no protective wrap. These AERs use a liquid chemical that is capable of disinfecting and or sterilizing. But once that door opens on that thing, there's no protective wrap. So we use the AERs for things that are semi-critical. If they're only going to touch the mucous membrane, so they can come out, be dried, and dried again because you don't put things away wet, hung up to dry, and then it can be safely used on a patient. Though not sterile, it has a should have very few bacteria on it, and they should not be growing on it because you put it away dry. Now we're on cleaning chemicals and lubricants. Look at the picture on page 146 of that little crime scene. So the cleaning chemicals that we're going to be using should be able to remove all of this with some aid, some help from us, brushes and things like that. One type of chemical product that we use is called an enzyme. So enzymes there's three main categories of enzymes that we use. Protease enzymes remove or help to remove, they break down blood, mucus species, and albumin proteins, protease. And then there's lipase. Lipo is fat, just like in liposuction. So lipase helps break down fatty deposits such as bone marrow and adipose tissue. So anytime there's a surgery, these two things get on the instruments. And then there's amylase, which catalyzes starch. So between these three enzymes, this is a good beginning to the cleaning process as far as being in decontamination. Remember, the real beginning of the cleaning process should begin at the point of use. So you have your right? Your three types of enzymes. Now, those are used to break down tissues. Then you have detergents. So detergents should contain emulsifiers, surfactants, and chelating agents. An emulsifier helps to bind things together that don't normally combine. If you looked at a Snickers bar ingredients list, it would list something that is an emulsifier. Basically, it's something that can help things like oil and water combine together. You emulsed them. A surfactant, which is something that lowers the surface tension of water. Have you ever seen a mosquito stand on water or a picture of it? Okay, if you lower the surface tension enough, that mosquito might sink. So detergents have to have surfactants. If you don't have a surfactant, then the water will not be very good at getting into these very tight places inside of these instruments because the surface tension, the same surface tension that allows a mosquito to stand on top of the water can keep the water from getting into the tight places. And then chelating agents, which are chemicals that hold hard water minerals in solution and prevent soaps or detergents from reacting with the minerals. Chelating agents, know those three. So protease, lipase, amylase, emulsifiers, surfactants, and chelating agents. You should know those. What they are, what that means. And keep in mind, there are things called antibacterial or germicidal detergents, but the main purpose of a detergent is not to kill germs. So a detergent's only going to kill germs if it is germicidal. It could be something that is just germicidal that you're using, and it's highly relevant. So if the instructions for use on something says use a germicidal detergent, then you would. But any detergent on instruments should be able to remove the soils, making it safe to handle. So what detergents kill germs? Germicidal detergents. What is the main purpose of a detergent? To remove soils, not to kill germs. Okay, just a second. Okay, here we go. Detergents and pH. So notice on page 147, there are some bullet points regarding neutral detergents, which are the most commonly used, alkaline detergents, and acidic detergents. Now, each one of these has its own advantages and disadvantages. Pay attention to what those are. You may be required to use an alkaline detergent, perhaps by a manufacturer, or due to something wrong with your water or something, trying to change the pH. There are acidic detergents as well. But by and large, the most common, the most preferred is going to be neutral because that is the least impactful, negative impact on the instruments and the machinery itself. Okay. Review of common chemicals used in the decontamination area on page 148. Keep in mind that each chemical is different and cannot be substituted for another. So a germicidal detergent cannot be substituted for a disinfectant. Also, you need to understand that you cannot make your own super cleaners. You wouldn't mix bleach and ammonia at your house. I hope you know that. If you didn't know that, that could release toxic chlorine gas into the atmosphere, killing you most horribly. You should not mix chemicals unless approved by the manufacturer of the chemicals. So no, you can't make your own disinfecting detergent by pouring disinfectant into detergent. Chemicals should always be used by the IFU. So if it says use 1 ounce per gallon, then that is how you mix it. Okay, there are pre-cleaning chemicals which are used at point of use. There are manual cleaning chemicals which tend to be high foaming. And then there are mechanical cleaning chemicals which need to be low foaming because the mechanical cleaners, it's like the difference between Dawn and then the Cascade that you put in your dishwasher. The Cascade is low foaming, the Dawn is high foaming. There are descalers that it says that they're not typically required if the water quality and detergent mixtures are correct. But you know, you probably will find your washer starting to get a little bit frosty looking on the inside. If you see it happening on your instruments where they start looking frosty, that could be that you have too alkaline of a thing happening, or that that it's time to descale your washer. Of course, use the instructions for use, which are clearly printed on the bottle. Lubricants should always be used according to instructions for use. They're not appropriate for everything. The lubricant that goes into the washer and is fed into the final rinse, which takes place after the wash, we call it milk. We call it milk because it looks like milk. I don't know what it tastes like. So lubrication should always be the appropriate lubricant. Some items require something like a mineral oil. That would be really power equipment that requires that. All lubrication is performed after the cleaning is done so that you don't rinse the lubrication off. There are stain and rust removers that should always be used according to the instructions. If you're using a stain or rust remover, pay careful attention to the mixing and the amount of time that it's allowed to be in contact with the instruments. If you exceed that time, you could be damaging the instruments. Okay. Nice pictures on page 150 and 151. Read these pages. You need to read these pages. On page 153, there's a couple things I want to point out to you. It says disassemble multi-part instruments. You may not even realize that something is a multi-part instrument. So look for the secret. If it's something like this, it's not going to come apart unless it does. I tell you, I have seen scissors that if you open them up far enough and then you pull it, it comes apart. But they're actually, it's very obvious that it's that kind of scissors. I saw it one time in the 972 years that I've been doing this work. Okay. Lumens and cannulated items should be fully submerged, and then flushed with cleaning solution. This will force air bubbles out of the lumen and ensure that the inner surfaces are in contact with the cleaning solution. So it says that if available, placing lumened items in a vertical soaking cylinder also helps to ensure that air bubbles are not inside the lumens. Okay. Air bubbles will rise, right? Because gravity pulls the water down. Otherwise, you have to make sure that you take something that has a lumen and maybe inject some cleaning solution into it, or the way you place it into the water, you go down like that. Make sure that it doesn't have air bubbles trapped inside of it. That cleaning solution, if there's an air bubble inside of it, it's not going to contact all the surfaces. Where the air bubble is, the cleaning solution is not. Okay. Watch for lumens. Watch for lumens. Sometimes they hide in places where you don't expect it. So on page 154, where it says watch for lumens and it has those tiny pictures, there are 3 of these objects that you often see that don't have lumens, and then you'll see one that looks exactly like the one that doesn't have the lumens, but it actually has a lumen. Like the screwdriver in the top left corner, there's 2 screwdrivers there. There's lots of screwdrivers that don't have lumens, and then there's ones that are used in specialty sets where they need to have a lumen and may or may not be used with the lumen, but they're there, and you have to pay attention and check and make sure that you don't have lumens. And the crime scene on page 155. Orthopedic instruments are often loaded with gross soil. Those reamers that are sitting in that metal basin, it is not possible to wipe them off with a gauze sponge at the point of use. So you may see point of use processing, point of use preparation not being done on things like that, because if they tried to do point of use preparation on that, all it would really do would be to shred the gauze. Okay. Toxic anterior segment syndrome. I'm going to point something out about TASS, and that is that it is not necessarily a bacterial infection. TASS can be caused by something that's not properly rinsed after it's been cleaned. There's a little bit of detergent or something left on the instrument could cause an inflammatory reaction inside the anterior segment of the eye, which could lead to blindness. Now, it is treatable if caught soon enough. But in this case, with ophthalmologic instruments, whereas with, let's say, an abdominal instrument, if just a tiny bit of detergent or the lubrication is left on an instrument, that is not going to cause the patient to go blind or even necessarily cause a reaction in the abdomen. Specifically of eye instruments, this is where TASS is a problem. So you may have special cleaning procedures for eye instruments in your facility. You'll definitely want to follow those. And the blue box, read the blue box. Page 156. This was in the Brown book. I talked about it. You know, you take instruments from backup, clean them. You don't know how long they've been sitting there. Dust does accumulate on those instruments in backup. Unfortunately, it's impossible to keep the department completely dust-free. Okay, cleaning instruments that cannot be immersed. It states here that instruments such as power equipment and cameras cannot be immersed in water. Well, I'm here to tell you that there are a couple examples where that is not true. With the Stryker cameras, the newer ones, the 1288s, the 1488s, and whatever they've come up with after that, it is actually necessary, according to the instructions for use, to soak them, to immerse them in the cleaning solution for a period of time. And with, in the beginning, that arthroscopic shaver that they had the borescope picture of, that item must be immersed. But you would go by the instructions for use. You can't just say, well, this camera can be immersed, or this power equipment can be immersed, so therefore this one can. And then vice versa, the other way around, you have to soak the arthroscopic shavers, and you must soak those Stryker cameras I mentioned. That is in the instructions for use, that it be done. Something like a pneumatic instrument, where it might use this air hose. This on page 157, that air hose is nice and curled up. It's a very dark color, like a very, very dark chocolate or black color. That hides blood very well. So that hose cannot be immersed, but it must be cleaned. And if it makes it into your decontamination room and it's all nice and curled up, don't ever assume that it wasn't used, because, like I said, it hides the blood. So blood just doesn't show up on it. You might see a spot on it that looks like, oh, look, the whole hose is shiny except for that one spot where it's kind of like flat. That's blood. Okay, the blood dried and it looks just like the rest of the hose. But if you get water or moisture inside of a powered surgical instrument, it can be very damaging to the instrument. So instructions for use, of course, and even if it has a cannula, you might not be able to immerse it. You still have to run water through it and cleaning solution and the right size brush, and then rinse it. Last thing I'm going to say on page 158. Now, is there any way to test something to see if it's been cleaned properly? You should know the answer to that. That was the beginning of this chapter. Okay. So that is it, the overview lecture for chapter 8 of the Isham textbook.